Tonight from the South Carolina Health Department, they're saying the coronavirus has the potential to become a public health threat. And there's another virus they say they're even more concerned about. 7 News' Melanie Palmer is with us now to explain. Melanie.
Gordon, the spread of this virus happens to be coinciding with another bug that is hitting people hard. That's the flu. And health officials are telling us when it comes to the symptoms of each of these viruses, they're hard to tell apart.
In today's connected world, an outbreak anywhere is a potential risk everywhere.
Alarming words coming from the South Carolina state capitol. State health officials explaining a new threat that spans the globe.
I see on the news that there are sporadic cases in the U.S., but it seems very limited.
But some travelers like Greg Tompkins aren't too worried. He's in the sky a lot for work. And while the coronavirus isn't on his mind while sitting on a plane, another one is.
I'm thinking more probably about just the regular flu and the people coughing coming down the aisle.
And doctors say he is not wrong. In fact, the state's epidemiologist told 7 News the flu this time of year is actually a bigger threat. But the symptoms for both of them can be hard to differentiate.
Is there any way you can tell the difference? I guess if you've been to China recently, is that the only?
Yes, if you have a recent travel from China, we will actually investigate.
This Columbia doctor says he's seen a handful of patients coming in worried they have the coronavirus.
It's also the peak season for the flu, so there's a lot of confusion out there. People think they might have.
As for Tompkins, he's staying updated on the spread of coronavirus cases, but he doesn't plan to stop flying, in this country, that is. Spread of this virus, like we said, happens to be coinciding with the flu. The Department of Health says they're working with the CDC to take preventative measures like screening at larger airports. The closest one to us is the Atlanta airport. They also told us the people who are most at risk are the ones who are taking care of the people that have already been impacted. Gordon?
All right, Melanie, thank you for that. So far, there have been 5 confirmed cases of this new coronavirus in the United States, none of them in the southeastern part of the country. Health experts say all of the people infected were previously in the impacted areas of China. Now, continuing that coverage of the flu in South Carolina, numbers released just today show South Carolina is still seeing widespread flu activity.